Hey guys, what's everyone working on?
Hi Tommy, just this EBD project.
What's EBD?
EBD, it's evidence-based dentistry, using the clinician's expertise, scientific evidence, and patient values and preferences to treat patients in the most clinically up-to-date and safe ways.
How would you even go about doing that?
5 A's are assess, ask, acquire, appraise, and apply. So we learned about how evidence-based dentistry, that's bringing in the scientific-based knowledge into the clinic. How you do that is use 5 A's. In assess, in the clinic, you see the problem that patient has or things that you do that can be fixed, but you don't know, how to fix it yet. And so you ask the question how you can, you ask focused clinical question with information you gain from assessing the patient. And then you acquire information. You can look at different research papers. We'll talk about that down the road. And you will look at those papers and you will critically appraise. See if the papers are good enough for you to take it seriously, you can bring it to clinic or not. Some of the questions you can use to appraise are, there are 4 that I have here. Is this information valid? Or are there any flaws in the study design or reporting? Is it biased? Is it from a reputable source? Can I actually apply this information to my patient? Is it safe to do that? And then eventually you just apply to the patient and you talk to the patient about it.
Okay, so what are some examples of good sources that you would even appraise?
What do you think, Will?
I can answer that question. So there's a lot of good sources out there. A couple off the top of my head, you could use something like PubMed or JADA. These are both good sources that search a multitude of web bases and search for articles that you might be interested in. They both have search options that allow you to narrow those results down based on keywords, types of studies, even the dates that they were published, and all that. So it can get pretty detailed. And one that I want to mention too, to you that's a really helpful resource is the Cochrane Library, which is, at its core has what we call Cochrane Reviews, which are really just a big database of systematic reviews and meta-analyses, which take in a ton of information and interpret the results of a lot of different medical or dental research. And it's for anyone that is trying to gain information on a specific topic or trying to treat a patient in a specific way, and allows you to get really high quality and extremely analyzed information based on that clinical situation.
Okay, well besides systematic review, you said there's a lot of other types of evidence. Like what are some other types of evidence? Because there's a lot of fake news out there.
There is a lot of fake news, and it's a good question because there's a lot of different types of evidence too. So a good thing to do is refer to the evidence pyramid, which when we look at it shows systematic reviews at the top because they have the lowest risk of bias. As you go down the pyramid, there's more and more risk of bias because there's going to be less broad scope of the information. So obviously the randomized control trials are good studies, but a systematic review is going to be a collection of a bunch of reliable trials and studies of those studies. So at the bottom we have our background information and expert opinion, which is kind of when you just ask a dentist, oh, what do you do in your private practice? Yeah, you might trust the guy, but that's really not the type of information we're looking for when we're trying to appraise evidence for evidence-based dentistry.
Okay, so EBD altogether is a way to better treat patients by using scientific research for better clinical outcomes, along with accounting for the patient's values and clinical experience of the practitioner. And the best pieces of evidence with the least bias are systematic reviews, like the Cochrane review that you were talking about, Will.
Mm-hmm.
And in order to interpret the information and the patient's needs, you would use the 5 A's.
Hit the nail on the head there,
I think
big
you
guy.
got it.
All right, cool.